Our audience and me.
Yeah, the button that says start.
Wait, did you start it, Jake?
All right. In 2009, a woman by the name of Tanya Luna, a single mother of 3, started feeling a little ache in one of her teeth. So she decided it was necessary to go see the dentist. So she scheduled some time off of work, went to the dentist, who fixed her up easily and gave her a couple of prescriptions to go home with. Everything was normal till Tanya showed up to work the next day, and she was asked to submit to a random drug test, which she did happily because she knew that she'd never done any illegal drugs. So when the result of the test came back positive for drugs. And so Tanya was fired from her job on the spot with no recourse, no chance for any kind of appeal, no second test, nothing. She spent months looking for a new job and eventually had to settle on a job for much less pay than she was used to. So what I'm going to talk about today is the unfair nature of random drug tests and why they should not be legal. For those of you who agree with that position, I hope to give you some information that will make that position easier to defend. And for those of you who disagree with that position, I hope to show you how unfair, unreliable, and actually unconstitutional the practice is. The reason why I wanted to talk about that tonight is because I see myself sort of as a civil libertarian in that I don't like to see people's rights trampled upon, and people have the right to privacy. I've also had to go through that procedure myself and find it sort of degrading. So, and in preparing for the speech, I consulted some Mayo Clinic manuals, a website for the National Institute of Health, and also reread parts of the United States Constitution. In this speech, I'm going to cover some of the legal problems associated with random drug testing. We're going to cover the unreliability of the tests themselves, and then some ways that the drug users try to overcome and cheat these tests. So first off, it's my opinion that random drug tests is unconstitutional and unlawful. Everybody knows if the police come to your house and they want to search your house, they have to have a search warrant. The United States Constitution, 4th Amendment says, the right of the people to be secure in their persons, houses, papers, and effects against unreasonable searches and seizures shall not be violated, and no warrant shall be issued but upon probable cause. And I think that this same level of proof and probable cause should apply to employers as well. So what constitutes probable cause? Well, a simple definition of probable cause is that a reasonable suspicion that a crime has been committed. And that's the standard that the police have to live up to in order to get a warrant to search your house. And I think the same should apply to employers who want to search your body. So not only does your employer not need probable cause, but in some cases they can actually request tests that are observed by the tester. I can't think of anything more humiliating and more of a breach of your personal rights than have to expose yourself to some stranger and go to the bathroom in front of them. So a lot of people who are in favor of random drug testing would say, what are you so afraid of? If you don't have anything to hide, why not just submit to the test? Well, to that I would say, if the police came to your door and they knocked on your door and they wanted to search your house, you wouldn't just let them in without a warrant, would you? So to me, the same applies. My body is more precious to me than my house, and so I'm not going to let anybody come in, search and seize what's on my person without probable cause. So we've just covered some of the slightly covered some of the issues, legally speaking, with drug tests. Now I want to cover what makes drug testing unreliable in the first place. According to a CBS News report, the false positive rate for most drug tests is between 5 and 10%. So that means if you show up to work and they randomly test you, you have up to a 10% chance of losing your job for absolutely no reason whatsoever. According to that same report, 10 to 15% of negative test results are also false negatives. So many of the people who are actually doing the drugs are getting off scot-free. So you have to ask yourself, if the people who are doing the drugs are getting off and people who aren't are getting false positive, what's the point? The Mayo Clinic It says that there are many prescription and over-the-counter medications that would cause false positives, as well as kidney disease and diabetes. And we're going to get to a few of those things a little bit later on. So we've covered some of the legal issues, some of the unreliable nature of drug testing, and I just want to get on to how druggies actually defeat these tests. It's actually fairly easy to do. If you do a quick search online, you'll find that there are actually hundreds of products and websites that will help you defeat a drug test. According to the National Institute for Health website, the 5 drugs most commonly tested for are marijuana, opiates, cocaine, PCP, and amphetamines. Each one of these drugs can be easily hidden or covered up by putting something else into your body. One of the things that is online, which is fairly easy to get, is this here. This is actually synthetic urine, and it comes in this bottle that shows you the temperature, because they do take the temperature when you have a drug test of your urine. So you just warm that up to 98, 99 degrees, bring that into the office with you and use that. Dump that into the cup, and voila, you pass your test. A couple of these other ones. This one here is for some capsules that you take. Will cover up anything in your blood. And this one here is for people who have to submit to hair tests. This is a shampoo. Will clean up any residue of drugs in your hair. So if these, again, you have to ask yourself the question, if the people who are really dedicated to doing drugs can easily pass those tests, and people who aren't doing the drugs, they can't pass those tests, then really what is the point? It seems completely unfair. So we've covered the legal issues, the unreliability of the tests, and how motivated druggies can actually defeat these tests fairly easily. Back to the Mayo Clinic, a simple list here of some of the things that will cause a false positive: Adderall, Ambien, Wellbutrin, Prozac, NyQuil, Advil, Tylenol, Zantac, amoxicillin, Tramadol, Midrin, Sudafed, poppy seeds, vitamins, nasal spray, codeine, Lortab, naproxen, kidney disease, and diabetes. So, and there are hundreds of others of things that can cause these false positive results that cause you to fail your test, and then will also cause you to lose your job. So the next time your employer asks you to submit to a random drug test, I would say that you ought to tell them what an insult you think that is to you, and also to tell them that you think that that's a violation of your privacy. So I'm going to say, finally, to wrap it up, calling back to our old First Lady, Nancy Reagan, when somebody asks you to take that random drug test, just say no. Thank you. You got it. All 5.